Today's presentation is on cardiac surgery and evidence-based postoperative care. Infection prevention is key in postoperative care for cardiac patients. And what we're reading is that the trend is moving towards 24-hour visitation in ICUs because it shows a better outcome for the patient, as well as a better understanding for family members of what is occurring with their loved one. The concern that has always been in the back of everyone's minds is the infection rate and how can we possibly make sure that this isn't increased. And it's shown that proper hand washing is the key to preventing infection, and that's been an evidence-based practice for a long time. So what needs to happen is to teach the family members proper hand washing before seeing the patient and after seeing the patient. And also to remind the healthcare worker that they are to have proper hand washing technique all throughout the care of the patient. It is also important to wash all the equipment that is used for the patient, particularly the mechanical ventilators that are used in the short duration postoperatively. Those have been shown to have many avenues for infection to enter into the patient, so that is critical that that equipment gets cleaned. What they're noticing is that if you also use calcium gluconate in both the nasopharynx and the oropharynx area every 6 hours, it will reduce nosocomial infection rates greatly after cardiac surgery. So infection in the ICU is not contributed to visitors coming in to see the patients, but it's just what does contribute is the lack of proper hand hygiene. So if we educate the patient's family members, it'll be a better outcome for everybody involved.
The second portion of what we want to talk to you about today is with nursing care, it is critical to be watching our client and our patient for the evidence of atrial fibrillation. The evidence has shown that there's a significant need to monitor cardiac patients postoperatively for atrial fibrillation. Atrial fibrillation is a significant problem in postcardiac patients. Two treatments that evidence-based to help decrease AFib postoperatively are first preoperative use of statins and beta blockers. And with high-risk patients, it is also necessary to add in aminodraone. The second is postoperative, is the use of magnesium and steroids. Studies have shown typically patients that go into AFib after cardiac surgery have been shown to have much lower magnesium levels. With cardiac patients that have had a CABG, the studies are showing that between 16 and 40% of the patients go into an AFib of some sort. With patients that have had a CABG and a valve replacement, the percentages are much higher. The percentages for that patient is between 36 and 63%, which is why we as nurses have to be very, very careful in watching exactly what is going on with our patients. Most of the dysrhythmias are shown to occur postoperatively prior to the 6th day. However, the significance between the 2nd and 3rd day postoperative seem to be the huge area of where the AFib starts happening with our patients. Post-op AFib usually is a transient occurrence. Using multimodal such as the one previously stated with the preoperative and postoperative medications, they offer promise of prevention and treatment of postoperative AFib. One of the things that we as nurses need to do is, if we see this happening with our patients, is contact the doctor and discuss the multimodal areas that can be used for the patient, given that this can be a life-threatening occurrence for the client and the patient prior to and after cardiac surgery. Thank you for watching our presentation, and we hope that you have learned something. The big silver.